Fever. The word alone can sometimes send parents into a spiral, but most fevers actually aren't dangerous. They're just a sign that your kid's immune system is doing its job. So let's talk about what actually matters when your kid starts to heat up. This is Daily Dose with Dr. Kate, where you get health tips from a board-certified pediatrician and neonatologist. So when should you be worried about a fever? A fever is a temperature of 100.4 Fahrenheit or higher. It's not the enemy. The body's turning up the heat to try to fight off infection, but how your kid acts is more important than the number itself. Times you should call your doctor include if the fever lasts more than 3 days, you notice your child is having difficulty breathing, they are in severe pain, or they start to show signs of dehydration, such as not crying tears and not peeing, if your child is difficult to wake up, or generally is just not acting like themselves. And if you have a baby that's 2 months or younger, any fever 100.4 or higher is considered an emergency and should be seen in the ED immediately. If your child's fever is safe to manage at home, you want to focus on their comfort and not just lowering the number. Offer fluids, dress them lightly. If they're miserable, fever-reducing medications like acetaminophen or ibuprofen can help. However, make sure you're dosing them for their weight and not just their age. Remember, ibuprofen is not safe for infants under 6 months of age as well. Don't panic if the number bounces around. That's normal. And you don't have to break the fever for your kid to get better. The fever is helping fight the infection. You don't have to fear the fever, just respect it. Watch your kid, trust your gut, and if you're unsure, call your doctor. We'd always rather that you ask. Now that you know all about fevers, follow the Keystone Newsroom so you can learn more from me next week.